You know, when you see a medical image, it's so easy to just think of it as a simple black and white photo. But it's so much more than that. It's an incredibly complex diagnostic tool where the line between a clear answer and a dangerous mistake can be, well, microscopically fine. So let's explore what that line actually looks like. And that brings us to the big question, right? What really separates a good, useful X-ray from a bad, potentially misleading one? The answer, as you're about to see, isn't always something you can spot with the naked eye. The difference is this. It's the absolute precision you see on the right versus the ambiguity on the left. And we're not just talking about a blurry picture here. No way. We're talking about a distinction that can completely change a diagnosis, and with it, change a patient's entire life. So let's start with one of the most critical factors, and honestly, one that's often overlooked, the human element. The skill of the radiographer in positioning the patient perfectly is the first, and you could argue, the most important step to getting a useful image. A perfect example of this is something called anatomic rotation. This is actually the single most common error, especially when it comes to chest x-rays. Think about this. If a patient is turned even just a few degrees, it can make their heart look way bigger than it actually is, maybe even triggering a false diagnosis for a serious heart condition. Then there's an error called clipping. And yeah, it's pretty much what it sounds like. Part of the body gets accidentally cut off the edge of the image. It's like trying to solve a puzzle, but you're missing some of the pieces. If you clip off the very bottom corners of the lungs, those are called the costophrenic angles, you could completely miss fluid buildup, which is a huge sign of things like pneumonia or even heart failure. So here's the bottom line. In the world of medical imaging, precision is absolutely everything. We're not talking about inches. We're talking about millimeters and degrees. That tiny margin is where a diagnosis is made, or tragically, where it's missed. Okay, so sometimes the problem isn't about what's missing from the image, but what's in the image that shouldn't be there. These are called artifacts, and they're literally like ghosts in the machine that can trick the eye and lead a doctor down a totally wrong path. You ever wonder why they're so insistent that you remove all your necklaces, piercings, and even certain clothes before an x-ray? Well, it's not just some random rule. It's a critical step to prevent these exact kinds of ghosts from haunting your image. This is a perfect example. That thing in your pocket, a zipper, the metal hook on a bra. These things show up as these bright, dense white areas. And to a radiologist, that could easily look like something really serious, like a tumor or some kind of dangerous calcification. Another huge one is motion blur. Just think of it like trying to take a clear photo of a moving car at night. It's impossible, right? If a patient breathes or even twitches a little during that short exposure, you lose all the sharp, critical detail. This is a massive challenge with kids and the elderly, and it's a top reason some images are just unusable. And you can see the result right here. It's a mess. All the fine, web-like details of the lung tissue are just gone. A radiologist looking at this can't confidently say there isn't a tiny nodule or a subtle pneumonia. The image has lost all its diagnostic power. And hey, it's not always about the patient. The machines themselves can have a bad day. You can get something called image lag, where a faint ghost image from the last exam gets stuck on the new one, or planking, which causes these weird brightness glitches. And then there's my favorite, quantum model, which is just a fancy way of saying the image looks super grainy, kind of like a photo you took in a really dark room because not enough light, or in this case, photons hit the sensor. So, we've seen the errors, we've seen the ghosts in the machine. Now, let's really connect these small technical issues to their massive, and I mean massive, medical consequences. This is where it all comes together. This says it all, doesn't it? A tiny, seemingly insignificant little error in technique can ripple out and lead to a completely wrong conclusion, and a massive, life-altering consequence for a patient. This table lays out the stakes with, frankly, terrifying clarity. Just look at that first one. If a patient doesn't take a deep enough breath, their lungs can look congested and their heart can look enlarged, perfectly mimicking the signs of congestive heart failure. Or an incorrect twist of the knee can hide a key joint, and a fracture gets missed entirely. And if your chin just droops a little bit, it can block the view of the C2 vertebra, a critical bone high up in the neck. The potential for harm here is just enormous. Okay, so after all that, you might be thinking it's a total minefield of errors. But the good news is there are incredibly smart strategies and a ton of skill that go into preventing them. So let's look at how the pros master the image. So what's the game plan?
How do medical professionals build a system that catches these issues and makes sure that every single image is as clear and accurate as humanly possible?
Well, it really comes down to a three-pronged attack. First up, communication. Simply giving clear instructions, okay, take the biggest breath you can and hold it absolutely still for me, is the #1 best defense. Second, daily calibration. Making sure the equipment is perfectly tuned up every single day prevents those digital ghosts. And third, and this is really cool, a process called reject analysis, where departments track every single rejected image. Not to blame anyone, but to find patterns, identify training needs, and constantly get better.
And this quote it nails it. It really sums the whole thing up. Getting a great image isn't just about pushing a button. It's a craft. It's this amazing blend of technical knowledge, incredible precision, and that all-important human skill of communication. So I'll leave you with this. The next time you happen to see an X-ray, you won't just see bones. You'll see a story about precision, about the hunt for absolute clarity. You'll understand the hidden craft that separates a simple picture from a life-changing diagnosis. So what will you look for?